Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Dr. Amy Dayries. Welcome, Amy.
Hi, thank you, Vanessa, for having me today.
Oh, happy that you're here. Now, Amy lectures on the topic of integrative dentistry for colleagues around the country. In fact, she's the first dentist to complete a 2-year fellowship in integrative medicine with the Academy of Integrative Health and Medicine. Today, we're going to be discussing her course entitled An Integrative Approach to Dentistry, Connecting Oral Systemic Health to Over-the-Counter Remedies and Dietary Approaches. Now, Amy, to start us off, could you help us understand what would attract dental professionals to attend this course?
Yes. So let's talk about integrative dentistry for a second. What is that? Integrative dentistry is sort of a two-phase approach to dentistry. It's having a working know-how of how other types of medicine or even complementary alternative medicine or holistic types of medicine approaches can support a patient's dental care. And it's also recommending those things to patients when they're appropriate as an adjunct way to take care of a problem. 70% of our patients in today's world are using complementary alternative medicine or an integrative approach to their own health care. And we were not trained in these techniques in school. And that is the reason all of the dental team needs to be aware of what is out there now, what is evidence-based, supported by evidence-based research, to help us to stay on top of things with your patient, to be able to be an excellent health resource for patients.
Got it. Well, that is important. That makes a lot of sense. Now, could you help us understand what do you cover in this course?
So in our course, we would cover a working knowledge of herbs that can be supportive of health and dental problems, essential oils, different types of exercises that can be helpful, where you can use acupuncture and other types of medicine modalities to support the patient, whether or not you do that or you have a working knowledge of what that could make possible for a patient, where those things can be used. Also, in today's world, a lot of our patients take pharmaceuticals, which can deplete a patient of essential vitamins and nutrients. Having a working knowledge of that, combining that with herbs and dietary approaches can be an excellent way to support a patient in their overall health. We talk about oral systemic connection. That is connecting systemic health problems that we can identify through the mouth. And the mouth is a window into about 90% of systemic problems, just as the eyes are a window into the soul.
Oh, I love that. This sounds like a really important topic, but also very interesting topic for not only our patients, but also for us as individuals and our families. Who is this most appropriate for? Do you typically have dentist and team, or who is your suggested audience? And can you also tell us what is the suggested format?
The suggested format, I would suggest a nice half a day would be excellent, a whole day even better, because I'm combining about 10,000 hours of continuing education into something that's very appropriate for the dental team. It's really, there's something for every member of the dental team, even spouses, to walk away where they can utilize something tomorrow or when they get back home tonight in terms of dietary recommendations. Last year at the American Dental Association, though, I geared it toward the hygiene chair and what a hygienist can use as an hour or their time where they have a captive audience, which is your patient, because your hands are in their mouth, what you can talk to your patient about.
I love that. And thank you for mentioning ADA. And so you spoke last year at the Emerging Speakers Series, correct? I believe they brought you back again this year.
Yes, it was so much fun. It was a great opportunity to bring into dentistry a lot of things that the medical community is talking about. And we need to know what that is. The mouth is not somewhere over here. It's integrated into the rest of the body. It's right here in the middle of everything. So it was really exciting to be able to bring into dentistry what the rest of the medical worlds are talking about today.
Agreed. And so when I say this year, for those who might be watching this in the future, we're talking about October 2018 ADA in Hawaii. And can you tell us a little bit more about the topic you'll cover there?
Well, actually, I have an opportunity to speak twice this year, Vanessa. So the first day is sort of a repeat of what I talked about last year. It's integrative techniques from the hygiene chair. You know, we see several generations of patients within families. A lot of times we can talk to our patients about salivary tests that are available, to talk about gene snips. These are what make one patient get well or not get well in comparison to the next patient, talking about how we can incorporate that technique into our practice. We're also going to be doing a lecture on Sunday of the ADA on holistic approaches to dentistry. So how can we be aware of the toxins in our environment, and where can we cut back on some of those exposures for our patients? Where can we help them in their desires to pursue natural approaches to their own overall health?
Oh, awesome. Well, before we go, Amy, is there anything important that the event planners should know that we haven't already discussed?
That's a good question. Anything the event planner should know we haven't discussed? Well, I hope to, I'm not really sure what you're looking for there, Vanessa. I'm sorry.
You know, as far as if there's anything we haven't mentioned that might be helpful for them to know about your topic, that would be good for their audiences.
Part of what I'm going to touch on also is on airway, and because that's an exploding field, again, connecting medicine to dentistry, and a lot of the current approaches that the medical community is talking about, and where the dentist what piece we play in the role of growing or developing an airway, and how that can set up you turning on somebody's parasympathetic nervous system versus sympathetic. I'm getting kind of sciencey here, but there is a lot of science to talk about that is so exciting and relevant. It's really changing the face of dentistry, and we want to be right there with it, riding that wave, because dentistry is such an integral part of someone's overall health. We can help you help your patient.
Fabulous. Well, there you have it. For information on bringing Dr. Amy Dayries to speak for your next meeting, please visit dentalspeakersbureau.com, where you'll find Dr. Amy Dayries listed. You'll find her contact information there, or you can reach out to us at info@dentalspeakersbureau.com. We'd be happy to connect you. Thanks again for being a guest here today, Amy. It was
Thank you.
very interesting. And until next time, everyone, be well.